So post-op instructions. Okay, so they've had a new set of upper and lower teeth that are supported by dental implants. What is it like that first evening and the next day and the week following?
So excellent question. I get this one all the time. The first thing I have to say is we start with our post-operative care before surgery. Okay. We're going to go over this in detail before the surgery, so there's no questions or concerns before this happens. But the night of surgery, you're still going to be numb. You're going to be numb for roughly 12 to 16 hours, just depending on each patient and how they metabolize it. So you really won't have any pain the first night. You're also going to go home, and it's after any surgery. You just kind of lay around, watch some TV, maybe have a little bit of bleeding, but because we've tightly sutured all the tissues together and you've got the teeth that are screwed down onto those implants, usually very little bleeding, just a little minor bleeding
and
here
a little
and there.
Soreness on the gums?
A little soreness, yeah. We're going to send you home with some ice. We're going to send you home with some medications for you to take. As I said, we're going to talk about this before surgery. We're going to give you a little list of when you should take your medications, at what time, what medications. As far as food, we want you to start eating right away. Because remember, we did sedation for you. We didn't want you to eat before surgery. I want you to start eating right away. Now, soft stuff. Remember, you're numb, so you're probably going to have some soups, puddings, yogurts, applesauces, things like that the first night. The next night, as the anesthetic wears off and you start not feeling numb anymore, I want you to start eating, but again, softer stuff. It doesn't have to be put in a blender, but if you could cut it with a fork, you can eat it. I would say most patients for the first week are still sticking to the really soft stuff, really cooked pastas, their applesauces, soups, and stuff like that. But after about a week, they're going to start chewing stronger and harder things.
So the next day, are you giving them like special rinses that they're taking, things like that?
We'll send them home with a whole protocol of mouth rinses to use. And we use some medications that's more, instead of a rinse, because it's hard to swish with the teeth in there, it's a gel that just put on their finger and coat the gums. It's it does help with swelling, but it's a minor pain relief as well. So it's a whole regimen of things that we do for our patients that, again, starts before surgery even. And some of the things we do after surgery with cold laser therapy that we use in our office along with cold therapy makes for better healing for our patients.
Now, you've had patients that are back to work in a couple of days, but you recommend what, like take about 4 or 5 days relaxing?
I would say 72 hours, 3 days. Give me 3 days on average is what we want. I had a patient go to work the next night, or not the next night, that night. He's a painter. And I thought, why would you do this to yourself? But yes, I want you to give me 3 days, but I have patients that can go back to work the next day, depending on what you do. If you're not doing a lot of heavy lifting or if you're not speaking a lot, if you're in customer service and you're on the phone all day long, you're going to want a good 3 days to feel normal to speak again. Somebody who does a lot of heavy lifting, just take it easy for roughly 3 days.
Okay, so, and like 8 weeks out, 6 weeks out, is that when they could just pretty much eat whatever they want?
At roughly 2 months, I tell you, all bars are off. You eat whatever you want. You want popcorn, you want ice, you want a steak, you want peanuts. It's time to go ahead and start.
And you mentioned ice, but you know you don't want them to have ice, right?
We talked earlier about ice. We both have this issue of chewing ice. You shouldn't chew ice, but these teeth are the strongest thing you're ever going to have, so you can pretty much chew anything you want, short of marbles and metal. Don't bite into your forks.
Now the first week, or at least the very next day, some people that don't want medications, you say they can do over-the-counter stuff.
Yeah.
And what do you recommend they take for that?
We use a combination of ibuprofen and Tylenol if those patients can take it. So a good combination of every 3 hours rotating between ibuprofen and Tylenol is the best pain reliever over anything else out there. Most prescription strength pain medicines just make you forget the pain. They don't get rid of the pain.
Now, do you have a call line? Like if somebody, they're bleeding, or people must get a little worried?
We do. When they leave, they have, before surgery, my cell phone number, as well as their driver has my cell phone number. If they have any emergency, they call me directly, for sure. Yes.